Next, we have Margaret Bryans. Margaret is the program manager of Munitu Ikwe Kegiikwe at Mount Carmel Clinic in Winnipeg. She's a community-based nurse who works alongside street-involved women, people facing homelessness, and people who use drugs and alcohol. Margaret is passionate about improving access to services for women affected by systemic marginalization and substance use who are not being reached by traditional healthcare models. She also has a feisty 20-month-old daughter who has taught her more about mothering than the rest of her work experience ever could. Margaret.
She's spirited, my little one. Thank you, everybody. I just really appreciate the opportunity to be here, and I also just want to let everyone know that I'm from Winnipeg, and I'm not sure how many people have ever been to Winnipeg, but our city is right where rivers kind of meet, and it's the traditional land of the Ojibwe, Cree, Ojibwe, and Métis peoples, and so I just want to acknowledge and honor that before we get started. So I'm here to talk about FASD prevention through service provision, and I'm probably not going to quite talk about that, actually. I just want to start by just showing you a picture of the community health clinic that I work at. If you Google Mount Carmel Clinic, the only picture that you can find is the wintertime picture of Mount Carmel Clinic, which I also think is apt, and so it talks a lot about, Mount Carmel Clinic talks a lot about heart, and I think that's the warmth in the cold winter of Winnipeg, and I think that's the way that we try to be also. Mount Carmel Clinic is the oldest community health clinic in Canada, so we're 86 years old this year, and so with a lot of that history comes a lot of complications and complicated history, but it also comes with some really interesting history, and so Mount Carmel Clinic has been working in the community with the people who live in the community for a very long time, and who the people in the community are has changed over time, and worked really hard with varying degrees of success to meet the needs of our neighbors, and traditionally has had a good record, especially in working with women. So we were a community health clinic where our medical director gave women birth control when it was illegal and was arrested and lost his medical license, and then 2 years later, and was supported by the clinic. So the clinic didn't say, oh, we don't know about this, rebel, renegade doctor. They were like, no, that's our medical director, y'all. And I think that's just some of the heart that Mount Carmel can bring to the table, and we are certainly not perfect, but I do think that spirit and kick around women's health is a part of why I appreciate being there. So currently we provide kind of the gamut of reproductive health services, from abortion access, perinatal nursing, midwifery, physician care. We have a daycare that caters to families who have inclusion, family support needs. And we also have services for sex trade workers and people who are homeless. And the biggest gap that we have is really around kind of pulling all of this together to look at women and pregnancy and substance use. And that's the honor that I have of working in this program, which I'm really excited to tell you a little bit about. Just really also want to locate myself in the mix. So this is my partner and our daughter, Georgia. And I put that picture of them looking surly up on the poster because I just wanted to also remember and remind ourselves about balance. And so this is a picture they sent me at 5:30 one day where they're like, where are you? And I have it now on my phone to remind me always that the things that are important to the people that we serve are also important to our hearts. And so I think that that's an important piece as well. And I'm also a nurse, and I'm also an activist. I feel like that is sort of what I carry to the table, and also with varying degrees of success. And that's why I take away the walk with those with whom we differ comment that happened at the beginning was good for me. So I only have 4 slides, so we're going to spend a little bit of time on really what the program that I work in. We're developing a single access site, so you could probably tell from Mount Carmel Clinic that we have a whole bunch of stuff, and really what we're looking at doing and trying to figure out how to do in a really good way is develop those things for the women that are coming to access the services. And so from very practical things like making sure there's a door at the right side of the building so that moms who are coming from the apartment blocks don't have a lot of space, don't have to walk all the way around to get it, little things like that. to really just looking at how we can support moms together. And so I just want to share a little bit about this name that was given to us by an elder, Manutu Ikwe Kagiekwe, it's Ojibwe. And the teaching that he gave us was really profound for us in the work that we do and for the team, for the women that are involved in this. And the teaching that he gave us was really around the fact that women already carry all of the teachings that they need within them. And the role of our program is not to do anything to them, it's to help remember that fact. And so I think that's been a real gift to us and in the way that we've kind of been able to move forward. And so I also have the Plains buffalo up there because I think that in a lot of ways we take care of each other. The way that we want to be taking care of each other is the way that some of our relatives do. And so the buffalo really take care and surround the little ones and surround each other, especially the mums and the aunties and all of them. So that is sort of the emphasis for the feeling of this program. And the key messages that I really have for us today are around the intersection of wisdom, research, and practice. And I just really want to bring to the table the importance of having, because I'm in program development, so I have a team that just started. We've been working for a year, and who we've been working with are women with lived experience, experiential women, peers. Those are the ones who are telling us what to do. And thank goodness, because I'm a nurse by training, which is in a lot of ways not super helpful to the work that we do, and regularly tell me that I am off track and to rein it in a little bit in different ways. And so that's been a gift. But I think we really need to acknowledge the fact that this work is impossible unless we have people who are impacted and who have that wisdom and expertise and are valued in a really true way. So in a way where I don't just go and say, hey, what do you want? And then they tell me, and then I use my nursely knowledge to say, well, the first thing we actually need is a nurse. Where in fact what we're doing is hiring the staff and the team that they've said are important. So hiring women who are experiential and who are peers and bring strong gifts to the table. Those are the things that we really value. And I think that's a gift that the NAT has given us also in those of us who have that value and passion is that, how am I doing? Am I done? 1 minute? Okay. That give us that passion to be able to do this work. And so I think that for me, the NAT has been so helpful in honoring women's wisdom, and especially women's wisdom who are rarely heard, who have a voice, because I don't have any trouble having this bonkers idea of like, people needing voice is ridiculous. I don't have to explain that to folks here, I don't think. But I think really the bottom line is this, is that the NAT has given us the opportunity to have tools and research and colleagues and friendships that have developed with me and that have really allowed me to ask people what's happening and what's working in other communities. And I think the generosity of spirit of sharing has been remarkable. So I have literally been able to go onto Her Way Home site and pull off interview questions and adapt them to our work. So I think that, for me, has been the biggest benefit. And I also think that the network action team really resonates with the teaching that we were giving around this program. And so for me, that feeling around carrying those teachings and finding ways to make those teachings true for broader communities has been really meaningful for me and for the women that we work with. So we've shared the 10 components of FASD prevention with very frontline workers, and it's been a really benefit. We've shared other things. And so that's really the piece that I just want to just pull together, is that in program development, that is a critical component to the work that we do. So thank you for your time, and I'll be around later.